Hello, everyone. Hope you're all doing well. If you've been listening to Brain Health with Dr. Nissen, you are probably familiar with the idea of psychedelics and how they're being studied for mental illness. And so today I am really excited to present to you an interview that I just had with Rick Doblin. Rick Doblin is the executive director of MAPS, which is perhaps the most pioneering organization looking at psychedelics for use as a possible medication, as a possible treatment for mental illnesses. So, in particular, MAPS is really excited to just have their phase 3 clinical trials published. And so these were looking at the use of MDMA-assisted therapy as a treatment for PTSD or post-traumatic stress disorder. So there's going to be a lot of acronyms here. I wanted to kind of orient you all to everything that we talk about during our conversation. So first of all, MDMA, you've probably heard of it before as Molly or ecstasy. It's been thought of for a while as sort of a party drug, but what Doblin and his colleagues have found is that it can be very therapeutic when used with therapy. So I recently wrote an article about this for ABC News, and it's talking about this MDMA-assisted therapy, meaning that MDMA is used in addition to therapy, like talking therapy, psychotherapy, with a therapist, basically as a tool to move you into a state where you're able to be perhaps more reflective, you have less of your defenses down, and you're able to have more productive therapy sessions because of that. So that's the idea with this MDMA, and what was recently studied and published in Nature was, which is an incredible journal, was their phase 3 clinical trial. So this is another thing I wanted to explain, is that whenever medications are undergoing study for their possible therapeutic benefit, they go through different phases of clinical trials. So the phase 1 clinical trial is basically looking at safety. So it's going to look at a small number of healthy people and say, is this, something that's going to kill someone or really harm them? And then assuming that the results from that are fine, then it'll move into phase 2 clinical trials, where they're going to be looking to see, does this do anything positive? Is it effective? And it's looking at a group of people with a disease and saying, is this effective? The phase 3 clinical trial is really getting towards the end, when you are then doing, a randomized controlled trial comparing the treatment against a placebo. So, really to see whether this is an effective treatment, and whether it got good safety. And so this is what they did with MDMA-assisted therapy for people that had post-traumatic stress disorder, PTSD. So I was so honored to be invited by Rick to join him in his backyard. We had a beautiful kind of spring day to discuss the results of this trial. So I hope you find this to be a really interesting conversation, and really an eye-opening conversation into psychedelics as a new class of medications and treatments that will hopefully help to revolutionize psychiatric treatment, the treatment of mental illnesses. And before diving in, one last thing that I wanted to say is it's important to remember that MDMA is still a Schedule 1 or a legal drug. So in no ways, am I or Rick or the people at MAPS encouraging people to go out and buy and try this on their own. This was all done within the confines of a clinical trial where safety was very closely monitored. So, all medications require the full scrutiny of the FDA before they can become legal and become prescribable. So definitely do not try this at home, but this is interesting nonetheless. So without further ado, let's dive in.
How would you describe MDMA?
I would say that just think about a deep breath. That's MDMA. You settle in, you have a little bit more relaxed, you sink deeper. It can calm you down. So I think that's one way. Another way to think about it is the Sabbath. As Rabbi Zalman Schachter said, it's like a time out of time. It's like a break. You're within our minds, we're often like thinking about what's next,
Right.
or what we have to do, or what just happened. So MDMA quiets your mind, so you're more physically present and emotionally present and
Yeah.
intellectually present. So you have time too. It's like something that you normally would say, "Oh, I can't do that. I'm too busy. I'm not going to think about that." You just have this deep breath, and you settle in and you say, "Hey, maybe I should think about that. I am going to die one day. What do I want to do with my life?"
Right.
Or that was terribly painful, and I always like run away whenever I remember it. Now maybe let me take a look at it.
Puts you in sort of this reflective
Yeah.
state. What's been found in this most recent clinical trial and why it's so important?
Yeah. Well, the most recent clinical trial was, again, the first phase 3 study ever of psychedelic-assisted psychotherapy. Because of the stigma of psychedelics, we felt we had to work with the hardest cases. So the first phase 3 study was with severe chronic PTSD. Many studies with PTSD patients exclude people that have previously attempted to kill themselves. We felt we need to include them. So we have people that had PTSD an average of over 14 years, and severe, chronic, and in most cases they've tried SSRIs or other medications or other psychotherapies. So what we know also from the SSRIs that are approved by the FDA and EMA for PTSD, that they work better in women than in men, and they don't work at all in combat-related PTSD. So what we showed is that our treatment works regardless of the cause of PTSD. That we had tremendous statistical significance, 0.0001. We had really great effect sizes. We had 0.91. Well, again, I don't know, everybody know what this means, but 0.91 was the placebo-subtracted effect size, meaning that's just for the MDMA. But it's 2.1 effect size for the combination of therapy plus MDMA,
Wow.
which is astonishing. It's 2 standard deviations away from the norm, which is really pretty big. That's what that means. An effect size, 1 is 1 standard deviation, 2 is 2. We had a great safety record. We had one woman try to kill herself twice during the study. Another woman had such severe suicidal ideation that she checked herself into a hospital to avoid killing herself. It turned out both were in the placebo group. We had nobody like that in the MDMA group. So what we have demonstrated from this study is that it was such an outstanding success that there's a very good chance that our second phase 3 study is likely to work as well. And so that realistically, assuming we can enroll enough people, we've got a very good chance of making MDMA-assisted therapy for PTSD into a prescription medicine.
Well, I told you a little bit kind of about my story. Could you tell me your story? And I get the sense that all of this, with this phase 3 clinical trial is the most recent part of a very long story
Yes,
for you.
yes.
So what's your story and how did this happen?
Well, I'd say how should I say this? When I was 18 years old, back in 1972, is when I decided to focus my life on psychedelics and go through psychedelic therapy, try to become a psychedelic therapist myself, and to try to bring back from the underground psychedelics.
Yeah.
My motivation was more political than therapeutic. I had grown up, when I look back on it now, I grew up in the most conducive context to think I could have an impact, meaning that I was born in 53, the height of American power, so this whole American exceptionalism kind of idea, that was just like everybody was. So I absorbed American exceptionalism.
Yeah.
Then I was Jewish, and so okay, now I'm the chosen people. So I kind of absorbed that. Now, of course, I realize everybody's the chosen people. But on top of all of that, I was white. On top of all that, I was male.
Yeah.
And I was the firstborn male child in my family. And then on top of that, my great-grandparents on one side and grandfather on the other had been immigrants and had fled anti-Semitism and repression from Russia and Poland, come to America in like 1880s, and then a little bit before the turn of the century, and then my grandfather came in 1920. But then the American dream, and they kind of were financially well off, and then I was raised to think that I had this multi-generational mission to work on deeper threats than just survival. Because, I was thinking today, a good image is like, the people on the Titanic that were super wealthy that were still going to die.
Yeah.
You can be on you can have all the resources in the world. You can end up in the concentration camps. You can end up in the Titanic. You can end up burned to a crisp in a nuclear war.
Yeah.
We all suffer from the consequences of global warming and climate change and species extinction and all of that. So I was just raised by parents who were very progressive, left-wing, liberal, and they imbued me with this sense that I had to work to help the larger Jewish family in the world, and that that would be sort of a purpose of mine. But I didn't know what how to do that or what ways. I have loads of Israeli relatives, but I didn't think I wanted to move to Israel. So it was really just when I first started taking, LSD and mescaline, it was a little bit scary because I had been led to believe that if you take LSD 5 or 6 times, you're certifiably insane.
Yeah.
And that if you take psychedelics, particularly LSD, you're going to have chromosome damage and deformed babies. And that you could have massive psychotic breaks and, just all the negative stuff I believed. So when I first questioned that, it was from literature. I was very much into books, and it was a book I read, a friend of mine in my Russian class gave to me. It was a tremendous book, and I handed it back to him, and he says, do you realize that some of this book was written under the influence of LSD? And I'm like, that's impossible. There's nothing good comes from LSD. It's a delusion, it's disorienting, it's hallucinations, So he said, no, it's true, check it out. And it turned out he was right. It was One Flew Over the Cuckoo's Nest by Ken Kesey. So that was the sort of crack in the propaganda edifice for me. And then when I started taking LSD, it opened me up to my emotions, which I had been previously disconnected from. I'd been just more very thoughtful, cognitive. And then it also had intimations of beyond ego states and how, sort of unitive states, the energy, the sense of time, and even in the deepest part of my brain, myself, where you talk to yourself, where I talk to myself, I realized that I'm using English, and I didn't invent English, and so it's like even in my most interior private spots, it's not really interior or private. So all of that just made me think that, this sense of connection that you can get with psychedelics beyond the ego, that has political implications. That would mean that we're all connected, and then how do we dehumanize? How do we commit genocide? How do we be racist? How do we trash the environment? So it was for political reasons, really, that I got into it. But the other part was also that I recognized that the psychedelics were doing what my bar mitzvah should have done. That my bar mitzvah was just like an outside rite of passage. But it didn't really touch me spiritually, or so. I didn't feel any different. I felt like lost and adrift. Again, I was the oldest of 4 kids, so I was the first one to go through this. And I had this idea from my parents, from the community, from the culture, that something profound would happen, some spiritual thing would happen. Well, it didn't. But when I first started doing LSD and mescaline, I was like, this is the kind of energies that I was thinking my bar mitzvah would generate. So anyway, all of that came together in me deciding to focus my life on psychedelics. But I mean, the key part that I would also say that the final step was having a lot of difficult experiences with psychedelics. I sort of kept at it because I thought it was important and I should try to overcome my resistances, but I was scared of letting go, scared of the emotions. So, I went to the guidance counselor at college, and the guidance counselor took me seriously. Now, this is 1972, so that's pretty amazing. Private college, new college in Florida. And he gave me a book to read, which was Realms of the Human Unconscious, Observations from LSD Research by Stan Grof.
Mm-hmm.
The absolute amazing part was that the book didn't come out published until 1975. So my guidance counselor had a manuscript copy, and he was in touch with Stan.
Wow. Stars aligned.
Yeah, and so it was reading Stan's book that confirmed everything for me, that here was this incredible research that was having an enormous impact on understanding the psyche, on understanding psychotherapy, on understanding spirituality. It was the realms of the human unconscious. But it was looked at from a scientific lens. So I was very suspicious of religion and dogma and fundamentalism, and yet this was a scientific lens looking at spiritual and therapeutic kind of experiences that had that sense that these experiences were legit, and that this idea that they would have these political implications was becoming ever more clear to me. But then the other thing that Stan was writing about was that there was a reality test to everything, all of the theories, and it was therapy. How do you actually help people get better? You can have, this, like you can talk to somebody for hours and hours about quantum physics and how we're all connected, but how does that relate to therapy or to reduce your depression? Or all of this was something that I became aware of fully from reading Stan's book. But then I also became aware that all this was shut down.
Yeah.
It was just, so it made me think, why is this shut down? Mm-hmm. And at the same time, I was in the last year of the lottery for Vietnam, and so I was a draft resistor, and I decided that I would, I studied a lot of nonviolent resistance, Gandhi and Thoreau, and Tolstoy, and Martin Luther King, a lot of stuff I would study. And so anyway, I decided that I would not register for the draft, and that they would eventually, they, meaning the police, would eventually pick me up and I'd go to jail. I didn't want to run to Canada or anything like that. But my dad was like, well, I don't think you should go to Vietnam, and, if that's your choice, okay. Mm-hmm. But he said, you're never going to be able to be a professional. My dad's a doctor, and he's like, you're going to have a felony record. And I was like, okay, that's a price I'm going to have to pay. But what am I going to do with my life? So then I stumbled on psychedelics, and I thought, aha, I can be an underground psychedelic therapist. That's my career. Wow. And I can work on bringing this suppressed thing back that was suppressed for a reason, for political reasons. So a lot of people, so for example, there's an op-ed that Tom Insel and Paul Summergrad have written, potentially for the Washington Post. I don't know if they'll do, about the New England Journal of Medicine paper, about psilocybin versus SSRIs for depression, and about our Nature Medicine paper of MDMA-assisted therapy for PTSD.
It's about both of them? Sort of perspective on both?
Yeah, their op-ed was going to be about that, both of that. But, what they were basically saying is that their narrative was that the backlash against the 60s occurred because of irresponsible use. And people had psychotic breaks, or people had difficult problems. And I myself had difficult problems. But I think that that's a misinterpretation of what really happened. I think those things happened, and that did cause a lot of negativity. But the real backlash against the psychedelic 60s was political. It was against the counterculture. It was against the Vietnam War protesters and the civil rights activists. And it was against, people getting psychedelics going right, getting inspired by their psychedelic experiences, losing a bit of fear of death, seeing more of our sense of connection, and getting involved in challenging the status quo.
Yeah.
So that, I think, is the real cause for the backlash.
Wow. Has the focus of MAPS is something I should know from my reading, but has it always been primarily on MDMA, or?
Yeah, it has.
Yeah. Okay.
Yeah. But there's a bunch of strategic reasons for that, and I think the strategic reasons have been borne out by the fact that we're the only psychedelic assisted therapy that's ever made it into phase 3.
Mm-hmm.
We're ahead of everybody else. The psilocybin people are still in phase 2.
Mm-hmm.
And so the strategic reasons are that MDMA is the most gentle of all the psychedelics.
Mm-hmm.
It's easier to integrate. It doesn't produce the panic reactions that other psychedelics tend to do sometimes. And also we believe that therapists and psychiatrists who are going to be trained to do psychedelics would be more effective if they did the psychedelic themselves.
Yeah.
I mean, you wouldn't go to a meditation teacher that didn't meditate or a yoga teacher that didn't do it. So we felt that in the fields of psychiatry and psychotherapy, there's more resistance to taking LSD or psilocybin than there would be to taking MDMA. Right. So all of that was sort of led to this idea of MDMA. Then the other part was, what are we going to look at? You need a MDMA, you need drug patient population combination.
Right.
So of all the ones that we're going to try to strategically choose to move through the incredible resistance culturally and scientifically and all that. So what we needed was a patient population that people were sympathetic with.
Mm-hmm.
Cancer patients were good. People that are going to die,
Yep.
we're all sympathetic with that. We needed a patient population for which the available medications didn't help everybody. And so that really led us to either cancer patients or people facing life-threatening illness or PTSD. So PTSD, it's at the time when we first decided this, it was Vietnam vets. Now, just to say that one of the most satisfying things that has happened in our phase 3 research very recently is that we've had a veteran that was in our study who had PTSD for a very long time, and now he's doing much, much better.
Yeah.
And he had PTSD from Vietnam.
Wow.
We've had somebody from almost 50 years
Decades.
PTSD, and they can still get better.
Yeah.
So anyway, we needed a sympathetic patient population. So it's veterans or women who've been sexually abused or domestic violence or rape and assault or childhood traumas. The SSRIs, the medications work for some people, but they leave a lot of people not any better off. They have side effects. They control symptoms, but they don't get to the root cause. They're good money makers for pharma because you need them every day forever.
Right.
But it was this combination of the drug and PTSD, and then also the fact that what MDMA did was ideal for treating PTSD, reducing the fear of painful memories, helping process emotions, opening up the mind-body connection, because a lot of, like Bessel van der Kolk, who wrote, The Body Keeps the Score, he's the principal investigator of our Boston site. And so, the MDMA opens up the mind-body connection. It just was
Perfect for it.
perfect. So that's how MDMA for PTSD. Now, also in 1984, I worked with my first PTSD patient.
Yeah.
And that worked great, and she got better, and she kept getting better and better and better. So all the time that we're hearing about neurotoxicity and people are, I keep watching her and she's getting better and she's not relapsing. Now she's one of our top therapists and she trains other therapists.
Wow.
But I knew MDMA for PTSD was great.
Yeah.
The cancer patients were good, but they were more of a response to neurotoxicity.
Oh.
And once that started changing. So in 1999 and 2000, we started in Spain with MDMA for PTSD. In 2000, I met Michael Midhofer, our lead psychiatrist, who wanted to work on psychedelics, and we decided to work with MDMA for PTSD, and that's how it began in the U.S.
Wow.